Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today in my Health Series 101 we're going to be talking about constipation. Constipation is incredibly common and shouldn't be taboo. There are some very common causes of constipation and easy ways to rectify it, so if you're interested in learning, please keep watching. So what exactly is constipation? Well, medically defined, constipation is the infrequent passage of stools, so less than 2 or 3 times per week, with an associated hardness of the stool. This may also be associated with difficulty passing the stools, straining, having painful bowel motions, and just general abdominal discomfort. Please note that bowel consistency and frequency will vary from person to person. So this is a note to say that constipation is a change to your general. If you normally go 3 times per week, but it doesn't cause you grief or discomfort, you're not necessarily constipated. That may be your normal. So it is important also to just review what normal is for you and any changes to that normal. There are several things that influence constipation, including dehydration, a diet low in fiber, pregnancy, not acting on your body's natural cues to pass bowels, so basically ignoring the urge to go, some medications, our age, having a change in your routine and or your diet, reduced physical activity, and quite a few medical conditions, including hypothyroidism or low thyroid action, Hirschsprung's disease, having high calcium known as hypocalcemia, some colorectal cancers, multiple sclerosis, Parkinson's disease, lupus, and irritable bowel syndrome, just to name a few. Finally, one thing I didn't mention earlier is there are some medications that can cause constipation as well. So if you've started something new and notice a change in your bowels, chat to your GP or your pharmacist about your current medications and see if they are causing your constipation. Constipation is commonly a diagnosis made on history, so after having a really good chat with your healthcare provider, but sometimes there are some investigations we can do to elicit if you have one of those predisposing medical conditions I talked about before. So if you've got a change in your bowel habits and you are prone to constipation, we may do some blood tests to make sure that your electrolytes are normal, your thyroid is normal, your liver and kidneys are working well, and so on and so forth. We can sometimes do an x-ray of your abdomen. In clinical constipation, all this is really going to show is that there is fecal loading, which is lots of stool in the colon that kind of backs up. But if we're suspecting that there could be something else going on, like a mass or something pressing on it, sometimes an x-ray can give us this, answer. But also sometimes people may feel constipated but not actually have any bowel motion to move, as it were. So it can help dictate if that's the cause as well. Sometimes we'll even do a CT of the abdomen, and this is more to look for masses or something causing an obstruction of the bowel motion through the bowels themselves, and it's a bit more sensitive than an x-ray. So how do we manage constipation? Well, of course, it's going to differ if you're talking about constipation in a baby versus someone who is elderly versus someone who is in their middle age. And I'll define middle age as anywhere from like 15 to 65. So, adulthood perhaps is another term for that. But essentially, let's just assume we're talking about adults here. There are a couple of common things you can do, including increasing your water intake and increasing your fiber intake. This may be through food, so whole foods, fruits, vegetables, whole grains, but it can also be in supplementation, something like a Metamucil or a Benefiber or something along those lines. Plus, reconditioning of your body signals and recognizing that you need to go can be really helpful too. So naturally, we will have the urge to pass bowel after we eat, and sometimes in bowel retraining, we suggest that people finish a meal, then go sit on the toilet for 10 to 15 minutes. If you get the urge, great, follow on with that, and if you don't, that's okay. But it can help re-establish the link between the body needing to go and you actually going, because sometimes that is lost. Of course, sometimes these really simple things aren't enough. So then we turn to laxatives, and there are several different types of laxatives. You've got bulking laxatives, which, as the name suggests, bulks up the stool. This sounds counterintuitive at first because you think that you want them to be smaller so it comes out easier. But part of the way that the bowel moves in a process called peristalsis is the bowel wall actually needs to be pressed upon for it to recognize there's something in it to then chug it along, I suppose is one way to say it. So if you've got quite small stools that aren't activating that, the bowel's not going to know to chug it along. So bulking up that stool and increasing that volume can activate that part of the parasympathetic nervous system and get your bowels moving. These bulking agents or bulking laxatives are often fiber related as well. Then you've got your osmotic laxatives. So osmosis is the process of moving water from one area where it's highly concentrated to an area where it's not. And examples of osmotic laxatives include lactulose and Movicol. Drawing water into the bowels softens them and can make them a little bit looser, as in not as hard to pass, which can be helpful because sometimes just knowing that going to the toilet is going to be painful turns people off actually needing to go, ignoring the signals, and you can see where the loop comes in. So far we've talked about bulking it up, increasing the water. The next type of laxative is the stimulant laxatives. So these stimulate the muscles in a more direct way to move things along. And examples of this include Dopalax and Senna. So you may have seen Senna in combination with Coloxal as well. So the Senocot is the movement-inducing part of it all. Then you've got your softening laxatives, such as Docusane. These are similar to osmotic laxatives, as they can draw water into the stool to soften it. So to summarize, constipation, incredibly common. Often it's because of lifestyle factors, so not having enough fiber in the diet, not enough water, not moving enough, as in physical activity, having a change in your diet or your lifestyle. Sometimes it can be medical related, so medical conditions, or pharmacy or pharmacological agent related. And the treatment often involves identifying your cues, increasing your water, increasing your fiber, and sometimes short-term laxatives to get things moving can be really helpful too. Of course, if you've got any questions, please chat to your GP about your unique needs. And that's it. That's Constipation 101. I hope you've learned something. Please let me know what kind of topics you want me to cover next by leaving me a comment, like if you haven't already, and subscribe too as well whilst you're there. And until next time, guys, stay safe, stay healthy, and I'll see you in a video very soon. Bye.